everybody. We're here for another session with my beautiful assistant on the camera. Leeching therapy. That's my magical set. And what I need first of all, of course, are the leeches. That's the jar I keep them in. There are quite a few over here. As you can see, they need a bit of water and air, which water I change every week. Now I'm gonna put another two on my legs, just under the knee at the internal side. At this special place, 2 fingers under, it is helping for the lower back pain. That's what I'll be treating today. So, get close up now. Let's see who's gonna be the lucky to be fed up. Fed, really good. These guys, they're still sucking, as you can see, the blood. I don't know what did this guy do, but I don't feel at all what is he doing. I know that he's doing some work. See this water a bit here? This water is coming out of him as he makes space inside him to absorb as much blood as possible, which means even that I don't feel he's working. This guy, I am feeding straight from the beginning. Now I'll put another one on each foot. That should be easy, because once they see their fellows are there, sucking, feeding themselves, they waste no time but bite right next. So I don't really need that, but I don't want the leech to suck my head instead. Okay. You fellow now. Here, there you go. Of course, he sucked the hand, put the glove, I mean. But now he sensed where is the warmer temperature in the blood. He's a bit smaller. Actually, he's not the smaller size as the other one, but the other one already had been sucking for some time. That's why he became bigger. After another 15 minutes, this guy will be as big. He's still trying to find some sort of a better base. Come on. Okay, I'll put them down just like that. They don't like the movement too much, so you have to basically lay steady. Where is the top of the jar? There we have another guy here.
Oh.
He's a bit small though. Get back in the jar. Wow, some guys are so big down there. So big. Maybe like normal size, middle size. Some are so big. Let's say like this guy, for instance. That's why I have some helping items here that I plan to use. Okay, I'll put a bit bigger guy. this one, I don't know what is he doing actually. Let's see now how it goes with this buddy. Come on now. See the other guy? A working class hero. Go on. There you go. There you go. Did you feel? That's it. Your lunch there. That's me. Yeah. Come on, you can do it. See the other guy? Be a good boy. There you go. There you go. Come on. So now, his other part is stuck here. And we should somehow remove it. It's better for him. Yeah, there we go. He knows what to do. This one, it's a bit bigger, which means he's more experienced. They're all, of course, medical leeches. So they come from a special farm where they're used to sucking blood. Some of them. The more they have sucked before, the bigger they are. And the better they know how to do it. See this guy? He wastes no time. He wastes no time. Yeah. We can of course help them a bit by gently massaging their bodies. Yeah, now he bites it really, yeah. I can feel that. The feeling is not that sharp because as soon as they bite, they release some painkillers, natural painkillers they have inside the blood, as well as the thing that prevents the blood from becoming thick, which is the main thing, in order for them to suck enough quantity. I'm not sure if this guy is working. Come on, guy. On it. Keep on eating. Yeah, he's ready actually. See? I just reminded him and he released himself. Yeah. Now the bleeding will begin. Not so much. Especially that I put them for second time at this spot, the bleeding is less and it will be less longer. Now I put this guy who is like drunk and doesn't bite anymore, could not do anything. Look at him, like a drunk. He's incapable of resistance. I just put him in my other small bottle where I keep the fed ones. There we go. Important is to keep the hungry ones and the fed ones separately, otherwise the hungry ones will eat the blood of the others. They're gonna kill each other. I don't really need that glove anymore. One of the other things I had prepared is the lemon. The piece of lemon is helpful in cases when they got stuck at something we don't want them to, or they continuously refuse to let go afterwards. So just a bit of touch of a lemon on the end of the leech that is stuck to us or to the surface. It's enough. We didn't need that today. Very good. I don't want to hurt my pets. Of course. preferably not. There is almost no blood at all. Very good place. Okay, now let's remind this guy. Maybe he's ready. And in the meantime, I'm massaging the guy that just started his lunch. Reminding him he's not on vacation, he has to work. He has to suck out the bad blood out of me. The thick blood, the one that is not moving properly inside my body and is actually another reason for any of my illnesses. Besides, it's just a good spring clean, detoxification of the body. So the thing that I'm not bleeding a lot tells that the period is not too big. I put them at these places of the body like 16-17 days ago. That's not too much of a big period, but I would not put them like maybe more than 20 days after, because it's like all over again from the beginning. It has to be repetitive, but the breaks between the same places should not be too long. I can combine places, but overall the maximum of leeches you can put at one time, recommendedly of course, is no more than 10. Well, I'm not that heavy, I'm like 70 kilos, 70 kilograms, that means like 7-8 leeches, medium size basically is enough. And at least 1 week before the next session, no matter on what part of the body. I do this therapy each weekend at different places, but wow, this guy is really sucking now. Ooh, yeah, I knew he's bigger than the rest. He has some teeth. This one, is he moving at all? Maybe it's his time. Maybe his time is up. Release yourself. Is he still working? Let's see about it. So now, if we observe him closely, if there's any movement, that means that he's still sucking, he's performing. If not, we may push him further to release. But of course the best scenario is when they release themselves without any pressure from outside. I can see his belly is so full. See, now he is already drunk because he has lost his grip on the other end. See here, he's not sucking anymore. Maybe at all. Let's see now if there's any movement of blood. I'll help gently the digestion. That's it. He's so full but refusing to release. We should at no circumstances pull them away. Yes, he's feeding. I see how the blood goes and changes the shape of his body. See? He's definitely sucking and transferring some blood further down along his several stomachs. So I was saying we should at no circumstances pull them away. Even in the rare cases they have felt asleep, because not only this will leave a scar on the body, but most probably they will throw up back inside us the bad blood they had just sucked out. We don't want that. We don't want them vomiting back. Wow, yeah, now he's working. He's fully awake. Wow, big time sucking. He just needed that basic, obviously. Right. In the meantime, my right foot. This guy is a bit bigger. There is more space for blood inside him. Compared to other places I put the leeches on, here there is more of an effect and less of a disease. As I see, the bleeding is less, the color of the blood is lighter, which is also good, and they bite pretty fast and easily, which means the channels from the previous time, first time when I put their leeches, is good. They know their ways, and they're really cleansing the body. What is your impression? Say something.
Behind the camera, you know.
Compared to other sessions?
It's kind of fast. Pretty fast.
I don't think in terms of time it's a bit different.
Looks like it's easier for you now.
It takes more than half an hour. Well, the first one, the one that dropped, yeah, he was faster, but he was probably smaller. Well, this guy was bigger from the beginning, just like that guy, which is good. More blood out, more bad blood out. See how he's digesting. I think he's almost ready. He wants more and more, but his time is up. He can't anymore. There we go. You go now to the bottle with the full bellies. There we go. See, in comparison to the tiny, hungry leeches, how thick are those? How fat are they? I'm going to release them in tames next week after another session. They'll be fine. Okay. That's it. See you.